Bonjour tout le monde. Good morning, everyone. Thank you very much for being with us this morning. I'm here on the traditional territories of the Mississauga of the Credit, the Anishinaabe, the Haudenosaunee, and the Huron-Wendat. Je suis ici à Toronto sur les territoires traditionnels des Mississauga, Anishinaabe, Haudenosaunee et Huron-Wendat. Nous sommes ici aujourd'hui pour encore sonner l'alarme sur l'état de nos centres d'hébergement et de soins de longue durée. Le rapport qui a été présenté hier est encore une autre alarme. C'est le moment absolument d'apprendre les leçons de ce moment de la pandémie. On sait que des milliers d'années, des milliers de résidents de nos centres de soins de longue durée sont morts d'une mort évitable à cause des lacunes dans le système, à cause des fautes structurelles dans notre système de soins de longue durée. Pour toutes les personnes, moi inclus, qui ont perdu des proches pendant la pandémie, on dit stop, on dit que ça suffit, on dit que c'est le moment de travailler ensemble d'une manière coopérative à travers les niveaux de gouvernement, de créer un système qui fonctionne, de créer un système qui assure la dignité de chaque personne qui habite dans un centre de soins de longue durée dans notre pays. And so we have more information coming out yesterday from the Auditor General of Ontario regarding the failures within our long-term care system with respect to the response, with respect to our preparation during the pandemic. We know that a humanitarian crisis unfolded throughout the pandemic in our long-term care centers. Thousands and thousands and thousands of lives have been lost avoidably in long-term care centers across this country, many of them here in Ontario. And for those of us who have lost loved ones during this pandemic unnecessarily, for all of those who are still terrified for the care that their loved ones are receiving in long-term care, I say stop. And I'm sure that Mike and Laura join me in that as well. As always, we are here to talk about solutions. We are here to talk about what can be done right now and what can be done in the future to ensure that all of our long-term care residents can live in dignity. And with that, I'm so grateful to have Mike Schreiner, the leader of the Green Party of Ontario, with us, and Laura Tamblin-Watts, who has been a long time advocate that we've called on many times to share her insights on long-term care as an advocate and also as the executive director of CanAge. So I'm going to just jump right into it with both of you. You're both here in Ontario. Laura and Mike, can you please share your reaction to what I consider to be the very explosive report that the Auditor General of Ontario released yesterday? And Mike, we'll start with you.
Yeah, well, thanks, Annamie, for inviting me to join you today. And I am speaking from my Queen's Park office on the Treaty 13 lands and the Mississaugas of the Credit First Nation. And I just want to say my heart really goes out to the 755 residents and 11 staff who died because of COVID-19 during this pandemic. And just my heart goes out to the friends, families, colleagues, co-workers who lost loved ones and who just had to live through the humanitarian crisis that we've faced in long-term care. And yesterday's Auditor General's report was once again another report just showing the systemic failures in the way we care for elders. And you know, one of the things that was so profoundly disappointing for me yesterday was the minister's response to the report deflected responsibility and blame to everyone else without the minister actually accepting any responsibility. And I think if we're going to solve this crisis, we need to acknowledge responsibility. And I would argue every person in Canada, myself included, has to accept responsibility because we collectively as a society have failed to make the investments we need to make in elder care in general and in long-term care in particular. And if we're going to solve this crisis, we have to all acknowledge our responsibility in that regard. So, Annamie, I want to thank you for your leadership calling for national standards, because I think provincial and federal governments need to be working together. And I think coming up with a Canadian framework around national standards is the best way to start. I'll go into, I'm sure as this conversation goes on, some of the other solutions I want to propose, but that was my immediate reaction to yesterday's report.
Thank you so much, Mike. Laura.
Thank you, Madam Leader, Mr. Leader, and I want to acknowledge the territorial land of the Mi'kmaq, which I am on today. Bonjour tout le monde, merci pour votre attention de cette issue. Incroyable, en fait. We are still talking about what we have not done in long-term care. The Auditor General's report was scathing. It was not, however, a surprise. And it's important to remember that this government in Ontario deflected the Auditor General earlier in the pandemic and told her to stay in her own lane. So this report really shines a light on the multiple failures that have occurred, which were, as you, Madam Leader, pointed out, in many cases very easily avoided. We routinely are putting resources and supports into acute care. That's important, but not when you turn your back on our most vulnerable older adults in long-term care. And so this report made some very important recommendations. And I know that we're going to talk about some of those recommendations. It's certainly my point of view that each of these recommendations is valid and that they need to be done quickly and with agreement between federal, provincial, and territorial governments, as well as amongst parties. This should not be an issue of politics. This should be an issue of care, of justice, and of morality.
Thank you so much, Laura. And I apologize. I guess I want you to be where I am. And so I said that you're in Ontario, but I know that you're out east. My apologies for that. To both of you again, this is something, as you both said, that involves the provinces, it involves the federal government. We recently had a budget, the 2021 budget presented. I'm just wondering what your reaction was to that. Certainly for us, what you described is what we want. This is the time to really look at the system holistically and talk about how we're going to dismantle it so we can construct something that actually works. But for the two of you, what was your reaction to the budget? Laura?
We thought it was an important step forward in some areas, but really doesn't go far enough. And while critically important issues like childcare were front and center, and that is an important issue, we see the difference in investments by something like children's care to something like seniors care. And we're talking about that investment in tens and hundreds of millions of dollars, in some cases, billions of dollars of difference. So $3 billion to institute long-term care standards, which will be coming out by next September in 2022. But remember, that's over several years and divided amongst all of our jurisdictions. So it's about $200 million a jurisdiction, which is not enough to make fundamental shifts. $90 million, again, spread over certain years in order to start implementing some initiatives around home care. Again, a nice first step, but not the transformative investment that we need. Our demographic shift in Canada is rapidly aging, and these federal investments, while important as a first step, go nowhere near what we need to do as a country and as a federal provincial system working together to meet the current, let alone future needs.
Mike?
Yeah, so like Laura, I think we need as a country to be investing in a caring recovery. And so I was happy to see the childcare dollars, and certainly I'll be advocating that Ontario participate in a national childcare program. But I also think we need a national strategy to care for elders, and that was not in the federal budget. I'll comment more specifically in the Ontario budget, which came out a few weeks earlier, because I was deeply disappointed in the Ontario budget as well. It promises a minimum of 4 hours of care, which is something that many of us have been advocating for a long time, but it doesn't deliver it until 2025. And I'm sorry, elders need 4 hours of care now, not 4 years from now. The staff who care for our loved ones need the support of additional staff now, not 4 years from now. I mean, the levels of burnout in long-term care in particular are huge. And my heart goes out to the staff who, as yesterday's Auditor General's report, talked about, like, went into homes to care for people without adequate PPE, continue to care for people when the homes were grossly understaffed, did not have proper infection control procedures in place. I mean, the list goes on and on. And so I was disappointed in the provincial budget that we didn't see a permanent pay increase for PSWs. We didn't see a guarantee of full-time jobs. Half of PSWs don't even have a full-time job with full-time benefits. We didn't see the money to increase nurse ratios in our long-term care homes. And so if we are going to honor the elders and staff we lost in long-term care, we need to make the investments in this fiscal year, not 4 years down the road.
Thank you very much for that. And I have so much that I could say. I'll say a couple of things at the end, but I really want to make sure that we get to the propositions. It's always really important for me and for our party to be propositional and really to look to people like you, Laura, for those ideas. And so in the immediate term, we're still in this pandemic. We still have urgent needs in long-term care. What are the things that we need to do right now? And then we've talked a little bit about the long term, but maybe you can just put those two things together, and then I'll ask you, Mike, to comment on that as well.
We can do 3 things right now. We can fix it so that we have appropriate paid sick days. 3 days in Ontario is not adequate. We need 14 days, at a minimum 10 days, and that needs to be instituted immediately so that people can get the time, care that they need and deserve, and to make sure that they're not spreading COVID-19. The second thing we can do is make sure that we are getting as many vaccinations into the arms, not just of people who live in long-term care. We've done a good job now of that, but also the care workers, visitors to long-term care. And let's not forget the older adults in the community who have not been able to get into a unit or stand in line. We need to take mobile units to the people who are in the community to prevent them going into long-term care. And the third thing that we need to do right now is actually start taking the issue of the built environment, so the physical space of long-term care, seriously. 257 of our 629 long-term care homes in Ontario do not meet the 1999 standard for care. It is too long, and we have an opportunity to make more jobs, to invest in buildings, and to make sure that those built environments, those physical states, are safe and well. And then overall, what do we need to do in future? We need to not medicalize long-term care. We need to make sure that people who are getting long-term care are part of the broader community, that we don't keep people apart and separate as we have done over the time of COVID-19 to terrible loss in life, mental health, and crises across the board. And again, in last piece we need to do, I just want to emphasize the comments from Mike. We need a strategy, and we need an urgency, and we need an investment, and not in 4 years, right now.
Mike.
Yeah, so I want to just amplify what Laura just said about the importance of paid sick days and paid time off to get vaccinated. One thing that I found really disturbing was back in January, February, I had a few public health officials reach out to me and say that they were having trouble getting some long-term care staff vaccinated because they couldn't afford to take time off from work to get a vaccine. It wasn't because they were vaccine hesitant. They literally couldn't afford to take time off work to get vaccinated. And so to me, that's just like, why don't we fix this immediately? And Laura's right, 3 days, like we fought so hard, like for so much of this pandemic, the Ford government has been days late and dollars short. When it comes to paid sick day, they've been a year late and now they're days short. And the science table has clearly set a minimum of 10 days. Secondly, I'll agree with Laura. We have to accelerate funding. Like we need to hire more staff now. We need to pay them a living wage. We need to guarantee full-time work with benefits. In the case, and I just want to add for PSWs in the home care sector is pay their travel time as well. I mean, some of these PSWs going from home to home, like they make below minimum wage when you factor in the fact that their travel time's not being reimbursed. So let's accelerate that money now. I know the long-term care minister keeps saying, oh, we can't snap our fingers and just hire additional staff, but that's exactly why the government should have been putting more money into hiring staff last summer when their own staffing report said that. So let's accelerate that funding into this fiscal year, not 4 years into the future. And then I think long-term, I could go give you a long laundry list, but I think the main thing is we just need to start prioritizing care over profits.
Mm-hmm. Thank you so much for that. And I share my personal story because it informs my approach to this issue, of course, and because it's important for people to hear those personal stories so that they understand that there are people behind all of these policies and all of these actions that we're pushing for. My grandmother was a personal support worker. We had many women in my family, of course, an immigrant family, many personal support workers. These are people that cared. Many of them were nurses back in their home countries and in our home countries. You do this work because you care and you consider it to be a vocation. But she had no paid sick leave. There was no opportunity for her to stay at home if she was ill, and she went to work many times in pain and sick because she could not afford not to do so. And this remains the situation. And my grandma retired 20 years ago. The women in my family that continue to do this work, these are the situations that they continue to labor under. And it's a terrible thing to send or put someone that you love in long-term care and be terrified every day about the quality of care that they are receiving, and then to have that loved one pass away. And so this is the situation that thousands and thousands of people all across Canada find themselves in. They have to turn to long-term care and they see that it is not providing adequate care, and it is a terrible and unnecessary mental strain on them and their families and the loved ones in long-term care. And so Mike and Laura, thank you so much for proposing the concrete, actionable solutions that we can put in place now to make a difference now. We absolutely support a national strategy, a complete reconsideration and reimagining of long-term care in this country that involves all levels of government, all parties as well, because as you said, it is not a partisan issue. Merci beaucoup, Mike et Laura, pour vos solutions, surtout pour vos solutions, pour vos observations de la part de tous les résidents dans nos centres de soins de longue durée et leurs proches. C'est clair que nous avons besoin d'une stratégie nationale. C'est clair que les investissements ne sont pas suffisants. Et Mike, vous êtes absolument correct que oui, c'est quelque chose où tout le monde au Canada, nous sommes tous coupables, tous responsables. Et c'est à nous d'insister que les solutions soient mises en œuvre immédiatement pour aider les travailleurs et travailleuses dans ces centres et aussi pour protéger les résidents. And with that, I'll pass it back to Rosie to take us into the next phase. Thank you so much, Mike. Thank you so much, Laura.
Thank you very much, Ms. Paul. This ends the Facebook Live portion of the press conference. Thank you for joining us. Ceci met fin à la partie Facebook Live, conférence de presse. Merci beaucoup pour nous rejoindre. So now we will begin with questions. We go to one question, one follow-up. If the media would like to ask a question, nous allons commencer avec les questions, une question, un suivi. Please use the raised hand feature if you wish to ask a question, and please tell us which media organization you're with. Veuillez utiliser la fonction de lever la main, s'il vous plaît, si vous voulez poser une question, et veuillez identifier votre média, s'il vous plaît. Just checking. Yes, we have a question here from Adam. Adam, please go ahead and identify your media organization.
Yes, hi, thank you. My media organization is Guelph Politico. Thank you for taking my question. It's about the government's own independent panel on long-term care. I assume that report is forthcoming. How are you thinking about that? How that's going to stack up against the Auditor General's report? There have been criticisms about the impartiality of that panel. But what are your thoughts about what that government-sponsored panel is going to say different than the Auditor General?
Yeah, Adam, thanks for the question. So first of all, that report is likely coming out tomorrow. And what I'm calling for now is for the government to publicly release the report. Like, that's not even clear that that's going to be the case. And I think one of the differences will be because the commission report, and I argued for a public inquiry, frankly, so there would be more independence and more transparency. But one thing the commission report will provide are some personal stories, and I think personalize it a bit. And one of the things that that's come out of it is, or at least in what I've been reading in some of the testimony that has been released to this point, is just how horrific some of the living conditions for residents are. Everything from, Laura talked about the room. So some folks living in rooms with 4 people, which doesn't even meet current standards, to just the inadequacies of the food. How many times people were left in soiled clothing, not to the fault of the staff, like every person made that very clear, but because of the lack of staffing. The issues around loneliness and isolation. So I think one of the big differences is going to be some of those personal stories, which I think will resonate with a lot of members of the public. But I think a lot of the findings will be very similar to what you saw in the AG report, because as Doris Greenspan from RNAO keeps reminding everyone, we've had 25 reports in the last 30 years that have pretty much outlined most of the problems in long-term care. And what we've lacked is the political will to actually address those problems. And that's what I hope is the shift now, is that we will have the political will to make the investments we need to reimagine how we care for elders.
Just maybe on in the national context, back in September, one of the main reasons that we did not vote for this speech from the throne was because we had been calling for months for a national inquiry. And we continue to call for a national inquiry. We really need to have that public reckoning about what has unfolded and continues to unfold in long-term care across the country. So this is something I'm looking forward to learning about the results of this report, but we really also, this is something that is a national phenomenon. And so we really need to have a national inquiry as well, to take all of the lessons and honestly to make sure that there is no hiding place from really staring in the face of what has been done and what has not been done during this period to protect our long-term care residents.
Do you have a follow-up question, Adam, please?
I do, and it may be more of a national question. But I mean, we've been talking about long-term care this morning, and I think that's one aspect of the pandemic where we saw, a lack of long-term planning really fall short. I'm also thinking about, national capacity to make PPE, national capacity to manufacture vaccine and other drugs. Are we thinking, or are we seeing, I guess the collective we, since we were talking about how we were all responsible earlier, but are we thinking more long term, or are we just really stuck on getting to the end of this pandemic and not thinking about what might come next?
Well, thanks, Adam. We always try to do both. There's no question that there are urgent, immediate needs, and that's why I always ask Laura when she's with us, and our other long-term care advocates, what can be done now? What needs to be done now? What could be done tomorrow to save lives tomorrow, and to protect the most people immediately? But then we always talk about the long term as well. And so you heard Laura and Mike both sharing some of those solutions, the things that we could do right now, today, that would make a difference, but also the long-term structural changes that need to happen. So when we talk about the need for a national strategy, when we talk about the need for the provinces and the federal government to sit down together to agree on that strategy, when we talk about national standards and we talk about hours of care and regulation, regulated care rather, all of these things are part of long-term solutions. Community supports as well for people to age in place, all of those.
Solutions are very clear and the evidence is very thorough. Right now, what we need to do is have that political motivation to move forward, to save lives, and to make our country one of the places not just adequate to age, but really the best place to age. We can do that as well. I think just building on the point about tomorrow's report from Ontario, I do think we're going to hear many of the same things. It is very important that that report become public. And so we have been pushing as well for a full inquiry. We know that it will be released Friday afternoon, and the question will be, is the government going to make that report available immediately so that we can have full transparency? I'm hopeful that they will. That report is critically important because it is going to be not just making key recommendations, but it's going to look back and see what wasn't done and why. And we do need those answers. And where good things happened, where some positive changes came out of it, that we know to adapt those and bring those to scale.
If I could just maybe add, and I'm going to take it a little broader than long-term care for a second, and your response, Adam, is, as you know, I disagree with Premier Ford on many issues. One issue where I agree with the Premier is that we need to be more self-sufficient as a country when it comes to vaccine production, PPE production, et cetera. Not in a nationalistic sense, but more in a self-sufficient sense. And I would challenge the Premier, though, to look at that in terms of food security as well, because his vision of building back seems to be paving over farmland. So when we talk about self-sufficiency, yes, when it comes to vaccines, yes, when it comes to PPE, and yes, I would argue when it comes to food security.
That is all we have time for today. Ms. Paul, would you like to finish with a remark? Or
just to thank everyone for being with us, and thank Laura Tamblin-Watts and Mike Schreiner for being with us, for your advocacy and leadership. And just simply to say that all that is missing now is the political will. Canada could be and should be the very best place in the world to be in long-term care if that is necessary. It should be the very best place in the world to age. That is the ambition that we should have for ourselves. Nothing else is really acceptable. And certainly the only fitting tribute recognition of the lives that have been lost during this period is to do the work so that this never happens again. And so we will be looking to every level of government to cooperate together, to work with the experts and the advocates and the families to ensure that the broad consensus around what needs to be done is done as soon as possible, and that the investments that are needed are made. As we move to secure the future of our youngest citizens, we also need to be moving to secure the future of our aged and our most vulnerable citizens as well. It's not a choice between the two. We must do both at the same time. So thank you so much, Mike. Thank you so much, Laura. And we will see you absolutely both again on this. The advocacy will continue until the action is set in motion. Thank you very much. Merci beaucoup à tout le monde.